Welcome, everyone, to this educational video about Mesangioproliferative glomerulonephritis, or MES-PGN. This kidney disease affects the glomeruli, the tiny filtering units within your kidneys. We'll explore what it is, what causes it, how it's diagnosed, and the available treatment options. The exact cause of MES-PGN is often unknown, making it idiopathic in many cases. However, it can be associated with a variety of other conditions. These include infections like bacterial endocarditis or hepatitis C, autoimmune diseases such as lupus or IgA nephropathy, certain cancers like lymphoma or leukemia, and even genetic predispositions. Sometimes exposure to certain drugs or toxins can also trigger this condition. Identifying the underlying cause, when possible, is crucial for effective management. Now, let's delve into the pathophysiology. MES-PGN is characterized by an increase in the number of mesangial cells within the glomerulus and an expansion of the mesangial matrix, the structural framework supporting these cells. This proliferation and matrix expansion can lead to inflammation and scarring within the glomeruli. As the glomeruli become damaged, their filtering capacity is compromised. This leads to proteinuria, the presence of protein in the urine, and hematuria, the presence of blood. Over time, this damage can progress to kidney failure. While MES-PGN can affect people of all ages, it's more commonly diagnosed in children and young adults. Determining the exact prevalence and incidence is challenging because many cases are diagnosed after a long period of progression, and some may remain undiagnosed. Certain populations with higher rates of associated conditions, like hepatitis C or autoimmune disorders, might have a higher likelihood of developing MES-PGN. The symptoms of MES-PGN can vary greatly from person to person. Some individuals may have no noticeable symptoms in the early stages. Common signs include hematuria, which may cause the urine to appear pink, red, or cola-colored. Proteinuria can lead to foamy urine. Edema or swelling, particularly in the legs, ankles, and around the eyes, can also occur. Some people may experience high blood pressure, fatigue, and reduced kidney function, which can manifest as decreased urine output or changes in urination habits. Diagnosing MES-PGN typically involves a combination of tests. A urine test is crucial to detect the presence of protein and blood. Blood tests are performed to assess kidney function, evaluate electrolyte levels, and look for signs of inflammation or immune system abnormalities. A kidney biopsy is the gold standard for diagnosis. This involves taking a small sample of kidney tissue for microscopic examination, which can confirm the presence of mesangial proliferation and matrix expansion. Immunofluorescence and electron microscopy can further identify specific patterns of antibody or complement deposition. MES-PGN isn't a single uniform disease. It encompasses several subtypes based on the underlying cause or the specific patterns observed during kidney biopsy. For example, it can be classified based on the presence or absence of IgA deposits, indicating IgA nephropathy as a possible underlying cause. Other subtypes may be associated with specific immune complex deposits. Accurate classification is essential for tailoring treatment strategies. The treatment of MES-PGN focuses on managing symptoms, slowing disease progression, and addressing any underlying causes. Medications may include corticosteroids or other immunosuppressants to reduce inflammation and immune system activity. Angiotensin-converting enzyme inhibitors, or ACE inhibitors, and angiotensin receptor blockers, or ARB, are often used to lower blood pressure and reduce proteinuria. Diuretics can help manage edema. In cases where a specific underlying condition is identified, such as an infection or autoimmune disease, treatment will be directed towards addressing that condition. In severe cases, dialysis or kidney transplantation may be necessary. While there's no guaranteed way to prevent MES-PGN, you can reduce your risk by adopting certain healthy habits. Managing and treating underlying conditions like infections, autoimmune diseases, and high blood pressure is vital. Avoiding exposure to potential toxins and certain medications that can damage the kidneys can also help. Following a healthy diet, maintaining a healthy weight, and staying hydrated are all beneficial for overall kidney health. The prognosis for MES-PGN varies depending on the underlying cause, the severity of the disease at diagnosis, and the individual's response to treatment. Some individuals may experience complete remission, while others may experience progressive kidney damage leading to end-stage renal disease. Recent research is focused on identifying specific biomarkers to predict disease progression and developing more targeted therapies to reduce inflammation and prevent scarring. Clinical trials are also exploring the potential of novel immunosuppressants and other interventions to improve outcomes for patients with MES-PGN. Regular monitoring of kidney function and early intervention are crucial for maximizing the chances of a positive outcome.